Great.
I think it's working now.
Thank you.
Yeah. All right. Well, I can get us started. I don't think this presentation will be too long. I do want to allow time for questions at the end. So before we get started, just want to introduce myself. So my name is Kate Bonanno. I'm a talent acquisition specialist here at MSH, Management Sciences for Health. And I've been here for almost 5 years now. I started working as an HR coordinator back in 2018, supported onboarding, recruitment support for about a year. And then I moved over to work on our program delivery group. So I worked as a project associate for a couple of years. I supported a program in both Malawi and Madagascar. They supported a lot of clinical service work and COVID work as well. And it was a great opportunity to work with, folks all around the world to see some of the impact that we're making. And then just about a year ago, I switched back over to HR, and now I support recruitment as well as our internship program as well. All right, so hopefully you all can see my slides. Let me just project this so that it's slideshow view. Can you all see it? Okay. All right, so welcome to this presentation. Thank you so much for being here today. Just to give you all an overview of our organization. So we are a global health nonprofit organization, and we've been around for over 50 years in over 150 countries. We've worked with the private sector, civil society organizations, and our main mission is to strengthen health systems in the countries in which we work. So we really do try to aim to achieve universal health coverage in all of the countries that we work. And we do that through striving to be innovative in our approaches. So really committing to looking at the whole health system approach. And when we think about health system strengthening and looking at the whole health system, that really just means looking at the social factors, economic, environmental, and any other conditions that can affect the whole health system. And we really do pride ourselves on leading the way locally. So what that means is we're really trying to build these local experts on what they already know to really take ownership and feel empowered about the work that they're doing. So working with public and private sectors, civil society, faith-based organizations as well. All right, and another one of our main goals is to use data for decision making. So using strategies and approaches that are based on current research, results from our programs. How are we going to use what we've learned from our programs to make better decisions in the future? And then we also try to make sure that the work that we do has a sustainable impact, so that we're not just coming into these countries and kind of making an impact for a couple of years, but really hoping to make that change a sustainable solution long term. And I also did want to mention MSH is committed to diversity, equity, and inclusion. So we're committed to making our organization more diverse, equitable, and inclusive, really continuing to examine the work that we do to make sure that we are including this in the conversation and being public in our speech about our commitment to DEI. All right, and just to give you a little bit of history on our organization. So we were founded in 1971 by Dr. Ron O'Connor. And just before MSH was founded, Dr. O'Connor was working under the mentorship of a Japanese physician, Dr. Noboru Iwamura. And Dr. Iwamura was very much an inspiration for Dr. O'Connor. He was the only survivor of his high school class after the Hiroshima bombing, and since then went on to live a life of service to others. So his approach was very much focused on respect, being a humanitarian, really going shoulder to shoulder with people in the community. And it was this humanizing approach that really shaped what MSH's values are today. And just to mention, we are going through kind of an overhaul of our values as an organization. So we haven't done this exercise in a number of years. So we are close to making, a formal announcement of what our values are as an organization. And I'll just say that one of the biggest, keywords that keeps getting discussed is respect. And I think that that is something that we are very committed to as an organization in all of the communities that we work in our communications. And that is something that has kept me here for, almost 5 years, is just, the respect that we share to each other as colleagues. All right, and so just to share with you all just a little bit of the numbers and some of the impact that we've made during the COVID pandemic. So in 2020, we obviously had to make a huge shift in the work that we were doing. We actually did end up getting additional funding from some of our donors to contribute to COVID work. So in 2021, we were able to vaccinate over 16.7 million people in the countries where we work. We were also able to reach over 22 million people through risk communication messaging. And that could be through radio messaging, kind of going door to door. We had people congregating in large market areas in some of our communities, handing out flyers, just to really combat some of the misinformation that was going around on the vaccine and COVID, and really trying to, increase awareness of infection prevention and control measures. We were also able to support the training of over 50,000 healthcare workers and volunteers on COVID vaccine management, infection prevention and control, sanitation and hygiene, as well as supporting over 9,000 health facilities to prevent COVID transmission. All right, and then just to share here some of our main funders as an organization. Most of our funding does come from the US government. USAID continues to be one of our largest donors, but we are looking to expand our sources of funding as well. So we do have a few smaller programs that are funded by CDC Global Fund, UNICEF, and Bill and Melinda Gates, just to name a few. Well, I see someone's raised their hand. Grace, do you want to go ahead?
Sure, just a quick update. We can't see anything other than the first screen. It's not advancing for us.
Oh, okay, it's not. Okay.
You seem like you're on a roll. I didn't want to interrupt, but leave the middle screen alone.
No, that's fine. So is everybody else experiencing the same issue? It's just showing the same slide?
Yes.
Yeah.
Okay, let me try to stop sharing. And I'll try again. Sorry about that. Okay. Oh, okay. I see what's
Maybe
going
put
on
it in
here.
slide view.
Yeah, so I had it in slide view and it moved to a different monitor. So maybe I'll have to do it this way. Can you see the slides if I do that?
Mhm.
Yes.
Okay. Sorry about the technical difficulties. Thanks for mentioning that. All right, so moving along, and if you'd like, I'll share the slides with you all after the presentation, so you can go back and look at some of the previous slides. But then also just to share an overview of our country presence in 2022. So we are very proud to say that over 87% of our personnel are from the countries in which we work. So again, that really ties back into leading the way locally, engaging local experts for a lot of the roles that we support. Right now, we are in about 47 countries, and we have just over 1,700 total staff, with 1,400 of those staff being located outside of the United States. And also, did it advance? I'm paranoid now. To the next slide.
It did. You're good.
Okay, perfect. Here's just a more detailed list of a country breakdown in the continents and areas that we operate. So a lot of our work is in sub-Saharan Africa, Asia and the Middle East, Europe, and the Americas as well. All right, and just to give an overview of some of the different technical areas that we focus on as an organization, I like to say that we are largely a generalist organization when it comes to health system strengthening. So we have many different areas that we focus on. So it could be anywhere from maternal, newborn, and child health, infectious disease, HIV, AIDS, malaria, and other sorts of vector-borne diseases, as well as rebuilding health systems in fragile states, tuberculosis, laboratory and diagnostic services, pharmaceutical strengthening, so many different areas, just to name a few. And this is not an exhaustive list. It really depends on the scope and size of our program. So we might have, one program that's, $160 million in funding that has all of these different areas, or we might have, a small program that's maybe $100,000 in funding that just focuses on cervical cancer screening, for example. All right, and then just wanted to talk a little bit about some of the opportunities that we do recruit for as an organization. So just wanted to hear from you all, hopefully at the end, if you're looking for, full-time opportunities, if you're looking for internships, some of the full-time opportunities that we recruit for entry and mid-level. So you'll want to look for positions that end in associate or officer, depending on kind of where you fall with your level of experience. So if you're a little bit more on the junior side with 1 to 3 years, you'd want to stick to that associate level with us. Some of the roles that we typically recruit for, a senior project associate is a really great role to kind of get kickstarted into global health, because you do get so much exposure to all of the different departments within our organization. You're really getting to have a bird's eye view of how programs are implemented, from startup to closeout. Working with our communications team. If you're really into writing, there are opportunities to contribute to some of our deliverables, technical products, but also, there's a lot of that project management work as well. So, finance, contracts, procurement support, travel support. So just the kind of differentiating between kind of what the difference is between a senior project associate and a project officer, is that the associate levels are a little bit more administrative. They, obviously require a little bit more oversight. And then the officers, they might have a little bit more responsibility, less oversight, for example. So that's a little bit of a difference here. And then if you're interested in getting involved in some of the technical work that we do, a couple of opportunities that we occasionally recruit for would be monitoring and evaluation and knowledge management. So those are really great opportunities as well. So knowledge management is essentially, looking at some of the findings that we've found from some of our completed programs, putting that into writing, disseminating that information and saying, okay, here's what we've learned from this project. Now, what are we going to do? How are we going to make changes for the future? And then, so monitoring and evaluation is focused a little bit more on the data side. So looking at qualitative and quantitative data analysis, data visualization, tracking progress throughout the program to see, okay, are we meeting our targets? So it's a little bit more focused on Excel and data visualization. So just those are some different ideas as well. And then just to touch on, what are we looking for in candidates? So just, first and foremost, I think really looking for somebody who has a strong commitment to our mission, that feels empowered by the work that we do. I think that's number one. One of the things you'll find with all of our staff here is that that is one thing that really brings us all together. It's not just a paycheck. It's really just, feeling good about the work that we're doing and the impact that we're making. And then for some project management skills, of course, being proactive, organized, having strong attention to detail, strong communication and interpersonal skills, and then of course being a self-starter, having critical thinking skills. And then if you're looking at, more on the technical side, anything that you can include in your resume that talks about your experience with data analysis, data visualization, showing maybe a writing sample, any projects that you've contributed to where you've done research. So those are just some examples here of some of the skills that we're looking for and how you can showcase that in your applications. All right, and then lastly, I just wanted to share if you're interested in connecting with me on LinkedIn, I'm happy to meet with anybody individually, talk with you about where you're looking to take your career. If you're looking at internships, full-time opportunities, I'm happy to have individual conversations with anyone if you're interested. So I just wanted to leave that there. And so, yeah, that's pretty much all that I have on my presentation, and I'd love to open the floor for any questions or comments from anyone. I'm happy to answer any questions you have.
All right. You feel free to either just come off Zoom or just come off mute or raise your hand. Either way, I think I'll get things started. First of all, thank you so much. That was incredibly informative. And also, I think the consistency between what we offer and what you're offering is pretty significant. So a lot of the skills are skills that really Heller School graduates shine. And also in terms of the content and mission, et cetera, there's just a really strong overlap. So the question I would have is, for a number of our students, they are able to do an OPT or STEM OPT. Sort of how else do you work with sponsorship and for more than just the 1 or 2 years?
So in terms of sponsoring employees, I will say we don't require any sort of citizenship for internships. So if you are looking at, if you need academic credit for your internships, I will say for our internship program, we do require academic credit as they are unpaid. However, we are pushing to get paid internships. So that is a discussion that our leadership team is having, and they're very open to that. As of now, it hasn't been officially changed, but I just wanted to mention that that's something we're looking at for the future. So yeah, so as of now, they are unpaid and do require credit, and we do not require citizenship for that. For a lot of our full-time opportunities, though, I will say it's, sponsorship is something that we have done in the past, though it's not a typical thing. Usually we would do that for very high-level strategic positions that are quite difficult to recruit for. So I just wanted to be transparent there.
All right, great, thank you. Abdul, I saw your hand flickering. Feel free to just come off mute and ask your question. Also, if people are asking questions in the chat, I'm not paying attention to that, so let me start.
Yes.
Great.
Thank you so much. My name is Jim. My name is Jim Sua from the Global Health Policies and Management Program. I want to say thank you for the presentation. It was very great. And myself, I've been doing a lot of work back in Africa, Liberia. I didn't see my country name, but I was like, yeah, this is what I've been involved with back home. I work with a local institution back home where we were involved in helping the government reduce maternal mortality and also preventable blindness in the country. So I work with across rural communities, making the project mode of active recipient project and passive recipient. So we have community involved in every stage of the project and working with them to be able to deliver quality healthcare services to them. So just a quick question with the country that you guys work in. My first question would be, do you guys work along with the country health system in the country you work in, or you work with local NGOs that provide health services in this country? Then my last question will be to the position, the entry level position. Are these entry level positions here in the US or are they back in your project country? Thank you.
Thank you so much, Jim, for your question. And to answer the first question, so I know that we do work with local institutions in country. And what was the first part of the question? Could you repeat that again for me?
The first part of the question was if you guys work along with the health system in the country. Like, say, for example, you go to Kenya, they have a health system to expand health facilities to the rural area. So are you guys following that system in the country, or you guys just work along with local institutions?
Mm-hmm.
Either,
yes.
yeah.
I will say, in my experience, I've seen both. With a lot of the programs that we support, the Ministry of Health is one of our biggest counterparts in a lot of the countries that we work. So yes, I think depending on the scope and the donor, they might have us required to work with certain private facilities, but a lot of it is through the Ministry of Health as well. So I hope that answers your question. I can certainly follow up with my technical team just to see if they have additional insight on that.
Yes, sure. Thank you.
And then to answer your second question, so with a lot of our open positions, yes, there are opportunities to work abroad. I will say that if you're looking at one of our ads and it's open to global, so a lot of, we're looking at, hiring in any country in which we're registered. Just the important thing to note there is that, if it's a US based position, obviously we would want to engage somebody from the US. If it's open to global and say you have work authorization to work in Nigeria, for example, we would proceed with hiring based on the local labor laws in Nigeria, and the salary would be paid in local Nigerian currency. So we wouldn't pay, US salary or allowances to be based in another country unless it's a key personnel position on some of our programs, and that's usually for, project director positions. So for, just some of our regular positions that we have open, it would be paid in local currency depending on the country in which we are hiring.
All right. Thank you so much, Kate. Thank you so much. I will reach out to you on LinkedIn, and I can have some personal conversation with you. Thank you.
Great. Look forward to it. And Paul, I saw that you had your hand raised as well.
Great.
Yeah. Thank you, Kate, for the presentation. It was lovely. I just want to highlight one thing. What happens, I saw the part where you showed up the experience of the kind of people you employ, officer, and what was the other one? The other one was project or something. And I was wondering, a person who's just starting out in the health field, I'm an accountant, I'm in finance, so I haven't dealt with this before. I'm doing the global health policy program. Where does that put me? Does that put me at the entry level, mid-level? I've worked for about 9 years now. So I'm just wondering that how do I get in here in case I need to get in? Do I get in at the entry level or at the mid level? I'm from Uganda, so I've seen MSH before. I haven't interacted with them, but I've seen them. Yeah. So if I'm interested in getting in there, how do I get in and at what level?
Yeah, so that's a great question. And I think, if your experience, you've got over 9 years of experience in accounting, that definitely puts you above mid-level, I would say. So, maybe if it's not particularly technical, I think there's still opportunities to translate those skills into a career with us. I will say we actually do have 2 finance positions open at the moment. One of them is a cost and pricing officer. So it's not really accounting focused, but it is financial, working on the costing of some of our proposals. So I would encourage you to take a look at that position that we have open. So hopefully
is that in Uganda or it's global?
It's open to, I believe it's US and global, I believe, but check our website and it'll say on the job ad.
All right. Thank you.
You're welcome. Anybody else?
Again, Abdul, I just want to acknowledge that your hand was up before. And so I wanted to invite you to ask a question if you still have one. Grace.
Hi, Kate. I'll jump in while we're waiting for Abdul. Also kind of a question about entering into my question is a little bit different. However, so I was in the Peace Corps beforehand. I live in the US now and I'm from the US, but do you have any tips on like, if I don't want to work in the US, what I could do to like, be more competitive specifically in roles outside?
Yeah, so that's a great question. I will say it's difficult for us to have somebody live, like if you were willing to work in Cameroon, for example, or wherever, just know that the salary would be paid in that local currency. So if that's something you're comfortable with, that's great. And I think, Peace Corps is obviously something that we're always excited to see. I think having global experience is really advantageous. And if you're interested, I think in travel, there's always opportunities for travel as well. So say if we hire a position here that's in the US, there could be opportunities for that role to travel in country as well. A couple of our project associates that started a few years ago received travel opportunities within their first 2 years of employment, to travel to Madagascar for work planning. So it's a really great opportunity to meet local members of the team in the countries that you're supporting. Hopefully that answers your question. If you have follow-up, let me know.
For sure. I'll also connect on LinkedIn if I do have follow-up. Thank you.
Of course.
Super. Thank you also, Kate, for leaving your contact information. I think that's super, and a number of people will follow up with you directly.
Great. I'll just leave it up in case anyone didn't scan it.
Mhm. Wonderful. Are there other questions? Paul, I'm not sure if your hand is still raised or if
Oh,
you...
sorry about that.
No, it's okay.
This is not a question for me. I think this is more of what Keith just spoke to. I've been able to look at a lot of international institutions employment procedures on projects that are implemented in Africa. And I want to say I commend you guys for what you guys are doing, like working along with the local people in the country, like you just said. If you want to work globally, they have to PH you according to the standard of the country. So that is really great. And then you are encouraging local people who went to school to be able to have the opportunity to have the job, not leaving the US to go back home with a very huge salary to do the work that other people back home can do. So I really want to say this is a great model that you guys have, and I really appreciate you guys for that. Thank you.
Thank you so much for the comment. Any other questions about maybe full-time opportunities, internships, anything else I can help with?
Yeah, let me just talk about the internships. Those internships, how long they run for? As Jasmine talked about, we have something called OPT for us, the international students, and we have 1 to 3 years. So if I wanted an internship with you here, how long would it run for?
Yeah, so that's a great question. And we typically try to align our internship along with the school schedule. So we would have a fall internship, which might run from maybe September through November or December. Spring internship, which would go from maybe January or February through April or May, and then summer, which would go from June until August. But I will say that we are very flexible with student schedules. So, with classes, if you want to start a little bit later or earlier, we can also accommodate that, as well as be flexible with the number of hours. We're very cognizant of the fact that, if we are doing unpaid internships, some students might need to have, part-time jobs. So we're very flexible to work with those hours and making sure we're making the best experience for students with school and other competing deadlines. So yes, we try to stick to the school terms, but we are very flexible as well.
And I think for those of you on the call who are from the SID or COEX programs where you need to do a practicum, this I think internship in this case would be interchangeable with a practicum. So I think these are, and oftentimes our practicums are unpaid. because again, as you say, it is an academic requirement. So for those of you who are on the call, who are in those programs and looking for practicum placements, this would be a great opportunity.
Yeah, that's great. We work with a couple of schools that require practicum, so I'm glad you mentioned that. And so typically, when do those practicum requirements come into play? Is that something that happens every term, or is it a specific time of year that students are looking to complete that?
So is there anybody on the call who's in SID?
Yes.
Yes, so could you answer the question?
Currently, okay, so we do internship during the summertime, mainly if it's a dual, but then the ones that I do in one, I think they do it after the whole course.
Okay,
Those that are doing one master's degree.
okay. So now would be the time that people are looking for internships or practicum, excuse me.
Yep. And so right now we have 3 internships posted. So we have one that's focusing on knowledge management. We have another one that's focused on business development, and then we have an HR opportunity as well. And you know, if anyone has practicum requirements that happen maybe in the fall or the spring, we are looking at posting our fall internship opportunities in the next couple of months. So around April and May, we'll have those posted.
Okay. And I will be back in touch with you. And for anybody who is an MBA, social impact MBA on this call, we have a fall internship program for our social impact MBA students. And there are a number of those students who are dual with the Sustainable International Development. So I will make sure that the program is aware of this opportunity.
Great. And so what is typically the channel that most students go to seek out opportunities? Is it LinkedIn? Do they use Handshake, or is it through you that they kind of seek out these opportunities?
So it depends on the opportunity. So my office has a weekly newsletter, and we post jobs that we receive to that newsletter. So it functions as a job board. We also list those jobs that we receive on our alumni network, which is accessible to students as well as alumni, so that when somebody asks us for help recruiting, we're helping you with both our alumni and our current students.
That's great.
The second channel is through programs. So for instance, in the Sustainable International Development Program, where they require a practicum that's either over the summer or the year, there is a coordinator, her name is Mary Poor, who facilitates that for students. I work very closely with her. And then for the MBA program, Social Impact MBA, I actually oversee that internship program in collaboration with some faculty. So I'm a good one-stop shop, and I can distribute information, but there are other avenues for students to access information. And then of course, LinkedIn, right? And other resources that we actively promote.
That's great. Yeah, I will definitely be reaching out to you in a couple months when we get our fall openings up. Yeah, thank you.
Wonderful fall openings, and then also full-time openings.
Yes.
So
okay.
we want to help you with recruiting our talent. So so this is fabulous. Are there any other questions? I don't see any hands, and I don't see any LinkedIn. This was a wonderful session. Thanks so much, Kate. I appreciate you for joining us and letting people know. And also thank you for letting me record the session.
Absolutely. Yeah. Well, thank you so much for organizing this. It was great to meet everyone. And yeah, feel free to reach out to me on LinkedIn. I'm happy to chat with anyone else as a follow-up. So thanks again for putting this together.
Thank you, Kate.
Already did.
All
Thank you.
right.
Thank you,
Thank you.
Kate. Bye.
Thank
Bye.
you. Bye, everyone.
All right,
Bye.
take care.